All right, today we are jumping straight into the high stakes world of medical diagnostics. This is a world where one tiny, easily missed clue can be the only thing standing between a total medical mystery and a life saved. So picture this: a little kid's heart rate just plummets. A man is clutching his head, screaming that it's the worst headache of his entire life. In these chaotic moments, everything, and I mean everything, can hinge on one single piece of information, one clue that just cuts right through all the noise. And that's exactly what we're digging into today. In the medical field, that game-changing clue has a name. It's called a clinical pearl. Think of it as a small, super potent piece of wisdom. It's the kind of thing you learn from experience, and it can just instantly make a crazy, complex situation crystal clear. So in this explainer, we're going on a rapid-fire tour of some of the most powerful pearls a doctor can have in their toolkit. Okay, our first set of cases is all about the physical clues. The vital signs, the stuff you can see and measure right there in front of you. Let's open up our first case file. So, here we go. We've got a 4-year-old boy. His heart rate is only 60 beats per minute. Now, his ECG, which is basically an electrical map of the heart, is showing some pretty unusual patterns. We're talking delta waves and a wide QRS complex. Don't worry about the terms, just think of them as specific red flags in the heart monitor that tell a trained eye, hey, the wiring in here is all wrong. Now, on the surface, 60 beats per minute might not sound too crazy for an adult, but that right there, that's the trap. So just take a second and think about it. Looking at these numbers, what is the one mistake, the one assumption that could lead to an absolutely disastrous outcome? The answer is really the key to this whole case. And here's the pearl: you never, ever apply adult vital signs to a kid. For a 4-year-old, a normal heart rate is way up, between 80 and 140. 60 is dangerously slow. That's a condition we call bradycardia. You combine that with those weird ECG patterns, and it points directly to a heart condition called Wolff-Parkinson-White syndrome. The right move here isn't to wait and see, it is immediate action with a drug called atropine to get that heart rate back up. All right, let's jump to our next case. We have an elderly man who took a fall. He's on blood thinners, which, as you know, makes any kind of bleeding much more serious. He's a little confused at first, but then one whole side of his body starts to get weak. The CT scan is pretty definitive. It shows this classic crescent-shaped bleed on the brain. That's a textbook acute subdural hematoma. So the diagnosis seems really clear. But here's the twist. We know what happened, but the real clinical pearl here isn't about the diagnosis itself, it's about prevention. What was the single most effective thing that could have stopped this whole tragedy from ever happening in the first place? And this just shows you a powerful truth. Sometimes the best medicine is the simplest. For a patient like this, who is at high risk because of the blood thinners, the most critical intervention isn't some complex surgery or drug. It's a proactive, low-tech solution. Doing a simple safety check at home to get rid of tripping hazards and just reduce the risk of falling. Now we're going to move into our next section. This is where the dangers aren't quite so obvious. These are the cases where the real problem is lurking just under the surface, and it's hidden behind some really misleading signs. Case file number 3, a patient suddenly collapses. They describe this thunderclap headache, like bam, worst headache of my life, right in the back of their head. They're not fully conscious. This is screaming subarachnoid hemorrhage, which is a bleed in the space around the brain. But, and this is a huge but, the initial CT scan comes back completely normal. So, this is the million-dollar question, right? Does a normal scan mean the danger is gone? Is it safe to just send this patient home? This is one of the most critical, nerve-wracking decisions you can make in an emergency department.
The answer is absolutely not. And this is where the life-saving pearl comes in. A normal CT scan does not rule out this kind of bleed, especially if a little time has passed since the headache started. The definitive follow-up test is a lumbar puncture, a spinal tap. They're looking for something called xanthochromia, which is a yellowish tint in the spinal fluid that comes from old blood breaking down. If you find that, you've confirmed the diagnosis, and you've just saved that patient.
Okay, our final case file. A patient gets into a car crash. They're knocked out for a moment, but then they wake up, they're talking, they seem okay. This right here is the infamous lucid interval. But then, just as quickly as they seem to recover, they rapidly deteriorate and lose consciousness again. So if you look at that sequence of events, waking up and then crashing, what's the single most alarming part of this patient's story? It's a classic, textbook pattern, but man, it can be fatally deceptive if you don't spot it for what it is. The pearl is this: that lucid interval is not a sign of recovery. It is a terrifying warning sign. It's the hallmark feature of an epidural hematoma, which is a bleed between the skull and the brain's outer layer, usually from a torn artery. That period where they seem fine, that's the calm before the storm. It's a critical and shrinking window before a complete neurological collapse.
So let's just put our last two cases right next to each other to see the difference. On one side, you have the subarachnoid hemorrhage. It starts out of nowhere with that thunderclap headache, and the diagnosis can be hidden, so you need that spinal tap. On the other side, you have the epidural hematoma. It comes from trauma and has that incredibly deceptive lucid interval, and it demands immediate surgery. Two catastrophic headaches, two totally different paths to diagnosis, and it all hinges on recognizing the right pattern.
So, what's the big takeaway from all these cases? Well, they show us this really powerful mental model for solving complex problems. It's like a clinician's toolkit that goes way beyond just memorizing a bunch of facts from a textbook. See, this art of clinical reasoning really breaks down into 4 steps. First, you've got to identify that key symptom. Find the signal in all the noise. Second, you look for the pattern. How does the patient's story connect to the data you're seeing? Third, you recall the pearl, that little nugget of wisdom that just unlocks the whole puzzle. And finally, and this is crucial, you act decisively based on that insight. Let's do a quick recap of the really powerful pearls we've uncovered today. First, vital signs are absolutely age-specific. What's normal for an adult can be a full-blown crisis in a child. Second, sometimes the best intervention is just simple prevention. Third, a normal scan is not always a safe scan. You have to be willing to look for the hidden evidence. And finally, that lucid interval, that period of seeming okay after a head injury, it's a massive warning sign. So here's the thing. This kind of insight, it's not just for doctors. It's really a superpower of pattern recognition. It's about seeing the signal hidden in the noise and knowing which tiny detail holds the key to the entire puzzle. So my closing question for you is this: what patterns are out there in your world, in your work, or in your own life that are just waiting for you to see them?